February is National Heart Month and Black History Month. Expert Dr. Sakima Smith is here to share why it's important to bring awareness to both. So let's talk about February, Black History, Heart Month. I never really realized that they were the same month, but that's a great tie for these 2 months. And how are you at Ohio State and Health Equity going to use that, tie between these two events in February, Doctor?
Well, that's a great question, and I think it gives us a unique opportunity here at Ohio State to leverage our work with the Heart and Vascular Center, Davis Heart-Lung Research Institute, and the Wexner Medical Center. What we want to do is work together within each of these confines to build programs. So with respect to the Heart and Vascular Center, we're initiating Grand Round series that are focused on diversity, equity, inclusion, but are focused on equity, but also highlighting faculty, staff, and others that we normally don't really highlight that are making huge contributions to the Heart and Vascular Center and the Ross Heart Hospital at Ohio State.
Is it important to emphasize Heart Month specifically, not just for Black Americans, but everyone in the United States, so that we take that time to call attention to this disease?
Absolutely. I think sometimes people don't realize that heart disease is actually the #1 cause of death for all Americans, Black, white, men, women. It doesn't matter. And I think we need to make sure we keep that at the forefront of people's minds. It's critically important that we recognize that it is the #1 killer of all Americans, irrespective of race, irrespective of gender. And we need to spend more time, focus, and effort to understand why and pour our efforts with respect to research and education and equity behind cardiovascular health.
Yeah, I have noticed that Ohio State has honored and brought awareness to the fact that there's a lot of faculty and staff when it comes to Black History Month. How does that impact the university as a whole?
I think it's important to highlight and acknowledge the critical role that African Americans and Blacks have played over the years with respect to not just in the health field, but in cardiovascular medicine, and our contributions, and also still highlighting that there are things we can do better, ways we can improve, and with respect to diversifying faculty, staff, learners, but also building connections and networking with the community. I think we need to break down barriers and silos so we're one large community in Ohio State. So it's not the Ross is here and OSU is there and the community is there, but we're all together breaking down these silos and having engaging conversations, figuring out how can we lift everyone up. And I think that's the next step in terms of health equity and what we can do here at the university, as well as collaborating with the community.
Well, that brings the question, is this also an opportunity to bring young people or others who maybe hadn't thought about a career in health education or medicine?
I think this is a great opportunity to highlight what we're doing, the faculty who we have who are who are engaged in these works. We have different programming and efforts with local high schools and middle schools to bring students to campus to really experience what it's like to be a physician or a nurse or a pharmacist, to get that exposure firsthand, to light that fire, that enthusiasm, so they can see that there's a pathway. There are people committed to and developing these pipeline programs at an early age. And obviously the reward is down the road, but you have to start somewhere, and being involved in the community, bringing students directly onto campus at Ohio State, to the Wexner Medical Center, having them rotate through our cath labs and see what we're doing there, our research infrastructure and research programs, that really lights the fire and gets these young individuals intrigued to see a possible career in health sciences.
So what brought you to this?
That's a really great question. Well, with respect to my enthusiasm for research, I've always had an inquisitive mind. So I think that came naturally. What brought me here to Ohio State was the Ross Heart Hospital and the ability to train as a cardiologist. So that is what really is why I'm here today. And then it was just taking and utilizing and taking advantage of all the opportunities that were present here at Ohio State. I saw opportunities to develop programs, to be involved in diversity, equity, inclusion. And it's not just involvement peripherally, but there's an investment throughout the institution, throughout the entire college of Ohio State to put forth that effort to make change. Really, with respect to diversity, equity, inclusion, is just really giving everyone a chance in every single space to have their voice heard, So we value diversity, and Black History Month is a great time to highlight that. We want everyone to feel that they have a voice, so therefore we have inclusivity. But in order for all that to work, we need equity. So by focusing on all that, on all these different pillars, I think it just makes Ohio State a leader, and it makes a much better work environment. People want to stay, and improves the retention. I just think it really enhances our science and what we can do with respect to discovery and our work in the community.
You've mentioned your interest in heart failure, your interest in research. What brought you to interest in equity in medicine?
Another great question. Really, just realizing that there were disparities that were present and trying to understand why. And disparities in the sense that you would see, I would read data and literature showing that despite the great therapies that we have phenomenal medical therapies, we have transplantation, we have mechanical devices that help people live longer. And despite all of that, the rate of mortality has increased significantly over the past 10 years for young Black males. And why is that? What's driving that? And trying to dissect and decipher those underlying issues, I think was the key for me as a scientist. So can we blunt the upswing? Like, we shouldn't have those type of disparities in this country when we have all the resources, but maybe it's people aren't aware or don't have access. So just trying to understand what's leading to increased mortality in groups that we really shouldn't have those issues when we have, as a country, all these, these resources available.
Did you see that firsthand as a physician?
Yes.
Yeah.
Yes.
Let's go to your research. You've obviously got an interest in equity in medicine, but now you're doing research to bring awareness to that. So what is your research about?
Well, I have a very broad research program, but with respect to our work in health equity, we started to focus on a certain class of medications, and we've done this work for a while, and it's funded through the National Institute of Health and with support through Ohio State. Our goal was to understand, and as I mentioned earlier, we see disparate outcomes with respect to more adverse cardiovascular health outcomes in African American populations. And our goal was to figure out, could we potentially find a way to bridge that gap, to eliminate that gap? So we started to focus on medications that could lower your cholesterol, called statins, and then try to personalize this research to understand, could we, looking at genetic markers, assess why African Americans may not respond as well to these therapies. We know these are life-saving therapies that can reduce your risk of heart attack, can reduce your risk of stroke, and improve your overall health outcomes. But sometimes we were seeing that certain groups of patients, including and specifically African Americans, weren't reaping the same benefits. So we started to do some genetic testing and discovered that due to different variants, which is a terminology meaning that essentially one of your genes may be slightly different in terms of how you may actually metabolize or break down the drug, could reduce its effectiveness. And with work in the community and Ohio State, we've been able to show that at least identify those who may not benefit as well. So we can start to personalize our approach in terms of therapies in particular.
Is this a new type of research? I mean, I've done research, I think, in the sexes, but what about race?
Well, it's been going on for a while, so it is not new in that sense, but what we've looked at in terms of this particular class of drugs and the different variants in African Americans was new and novel, and our research group is the first to really perform that research.
Have you been able to come to any conclusions yet, or where are you in the research?
It's still in its infancy. We're making some strides and showing we've identified a couple of variants that have been linked to decreased effectiveness to a couple of different statin drugs. What that at least tells us, there's a signal that before we just prescribe any statin to any patient, we need to do a deeper dive and understand their genotyping, their phenotyping, and their risk profile. Long term, it will allow us to create a methodology to have more personalized medicine, creating an assay to screen patients to figure out what is the best drug. And this could be broadly applicable and beyond whether it's an African American or Hispanic or Caucasian. But once we go down this pathway and understand genetics a little better, then we can really personalize our care for everyone.
What is the science of health equity and diversity?
Well, the science So it's very broad, but in its general sense, it's population-based health to impact communities, and it's trying to understand really is the inequities, why do they exist, and what type of scientific tools can we use to dissect and understand those differences.
How did you advance that health equity through your research?
In our research group, we focus on statin-based therapies and trying to personalize care for African Americans to understand who may not respond as well or who may be at risk for having an adverse outcome with respect to statin therapy.
So what kind of changes are you seeing in certain communities when it comes to health equity? Are we getting better?
I think in general we are getting better. I think there's a lot more community engagement with respect to researchers getting out into communities, making changes, talking to the patients and the people in the community, and having them directly involved. Building that trust, I think, is critically important, and I've seen that happen.
So it's impacted care in a good way.
Absolutely.
How does this impact your research in what you're seeing in the community and your patients that you're dealing with?
I think I've seen more community engagement. Historically, patients and people in the community have been somewhat reluctant or of trusting the medical infrastructure, not knowing if we're going to turn around and utilize their information in a negative way, just because of historical context and things that have occurred. But now by getting out in the community, building this trust, building equity with the community, we're slowly breaking down those barriers, and we're seeing more engagement. People think that we're really entrusted and engaged, and we want to do what's right.
So specifically, what is Ohio State doing to create better outcomes and less disparity for these communities?
Well, quite simply, we're just getting out there. I think that's the key. We're putting effort into our infrastructure. So we now have a chief equity officer, we have chief diversity officers, and we have this huge community that are working together, coming up with strategies of how we engage with the community outside of when we see them in a hospital or an office visit. Going out to speaking at a church or a community event or having a health fair. Bringing them to our campuses, educating individuals, just being very creative and innovative in our approach, and not just addressing the needs when someone is hospitalized and they're sick, but getting out there while they're healthy, teaching them healthy ways of eating, just being engaged on a regular basis. And I think that builds equity with the community, and that builds trust. And then you have the opportunity where people are willing to be engaged with research because they know that they're an active participant and our findings will directly impact them.
Does it help to have a hospital, East Hospital, in a community like this where it is easier access for some in that community?
Absolutely. I think that is definitely helpful. I do think that we need more outside of a hospital, other infrastructures, other ambulatory care clinics, things that building throughout, not just OSU East is a great example. We need more throughout the city if possible. We need to utilize East and our other infrastructure, but we also need to utilize the Ross Hart Hospital. We need to be engaged with the local community here as well.
So this is Black History Month. What heart disparities should we be aware of during this month?
That's a great question. So to me, as a heart failure transplant cardiologist, I'm somewhat biased, but heart failure is, to me, one of the things we really need to be focused on, particularly because some troubling trends that we're seeing in young black men and women, is that despite the great care that we have, or the ability to offer great care and great medicines and transplants and mechanical devices, we're seeing an increase in mortality. That means death. And that is concerning. So to me, something we need to focus on from my perspective as a heart failure cardiologist is heart failure rates that are increasing in black populations and trying to understand why that is occurring.
Who inspires you as far as looking into health equity?
I think that's a good question.
Your patients, was it something that you just saw yourself?
Well, I think in terms of who inspires me is really going back to St. Louis, Missouri, where I was raised, and looking at my family and my grandfather who passed away from his second massive heart attack when I was only 8, and he was only 64 at the time, and he was a young man. So that opened my eyes to some of the disparities that could occur around cardiovascular disease. So I think it started there, and then just different mentors along the way. One key mentor for me was Quinn Capers, who recruited me here to Ohio State, and who still remains a close colleague and friend of mine. And seeing the work that Quinn did throughout the College of Medicine and Ohio State, that really rubbed off on me. And while I still maintain a basic and translational program, because of his influence, his impact, I started to become more involved in some of the work and research and efforts that he was involved in. And when opportunities came about to take on leadership roles, he encouraged me to step outside of my comfort zone and to take on those roles. And I'm forever thankful for that mentorship.
So how do you inspire and champion others to follow you?
Well, I try to lead by example. I think that's the best way. I try to practice what I preach. Our research lab, I think, is a very, very diverse environment with respect to thought, gender, ethnicity. So I try to lead in that regard. Try to set examples in how I conduct my daily life in our lab, and also as a vice chair and for here at Ohio State for our Department of Maternal Medicine, trying to figure out how can we improve diversity, equity, inclusion within our faculty, staff, and learners. We're doing a great job. Like any other institution, there are things we can continue to work on. We're not complacent. We have support from the top, and we will continue to try our best to make this a very inclusive environment. And I think we're a champion. At Ohio State, we want to be the best. We don't settle for mediocrity, and that includes our work in the diversity, equity, inclusion space.
What's the future for heart disease and the Black community?
That's a great question. I would like to see the future with respect to heart disease in the Black community improve. I would like to see rates of death and hospitalization decrease. I would like to see education improve, and I think that's the key, trying to understand what are the inequities, what's driving some of these disparities. I know that people are engaged throughout Columbus, throughout Ohio State, working together to try to solve this problem. It's a national problem. It's not limited to Ohio or Columbus, but we need to do our role as a state land-grant university to make an impact in our local communities and our local Black population, and have this dialogue and try to figure out how can we improve these mortality rates, how can we improve and have healthier lives for our communities and our citizens.
It does seem to be more of a national focus now, equity in medicine. So what do you see for the future in that regard?
I think equity in medicine will transform to personalized medicine. Understanding that everyone is different, understanding that everyone may not respond the same way to the same drug or the same therapy, making sure that everyone has access to all the great technologies and medicines that we have. That to me is the future. That's in the best case scenario, where if you have an illness, you have access to health care, you have access to great medical therapy, but also we're personalizing that therapy to you, and you're based on your genetic profile, your needs, and things of that nature. So it's just more personalized approach. I think that when we get to that point, our hospitalization rates will go down, our mortality rates will go down. We'll have healthier, happier communities.
How is your research affecting the Black community? What are you finding?
So right now we're focused on statin therapy, and statins are drugs that historically have been used to reduce cholesterol levels. But the reason we really focus on statins, and there's a couple that we really identify, is that we weren't seeing the same benefit in some Black patients. So we decided to take a deeper dive, and what we found is that some individuals have genetic variants that lead them to not have the same robust response as others. So that was striking, and that is why we need more personalized medicine, so we can identify individuals, populations of people, African Americans in our study at least, who may not have the same benefit as others with respect to life-saving therapies.
So your success, or the fact that you're in medicine, does that help draw young people to this?
Absolutely. When young people have the opportunity, whether in middle school or high school, to come to campus and see someone like myself or others, whether it's nurses, pharmacists, technicians in the cath lab, et cetera, that inspires them. They know that this is something that they can target, that they can reach. We've seen students come through different programs that we've had here at Ohio State in the Ross who have later majored in biology in college. A few have gone on to medical school. We've seen very readily, real tangible outcomes from just having that exposure, for these young individuals having that exposure on campus, seeing that they can achieve this, and this is a pathway for them.